Hi faculties, it's Salvatore again. I'm going to talk about management of osteoarthritis in different stages. First of all, osteoarthritis, as we all know, in the knee specifically, it is a chronic joint disease which affects the articulating surfaces. It affects the cartilage. For example, as we know, knee articulations is the femur. Femur is here, which articulates with here there is tibia and fibula, like this. So here there is the articular cartilages. If these cartilages they become inflamed, they are inflamed and starts degeneration, degenerative changes as someone grows up. So the joint here starts losing the way of moving throughout each other, which causes severe pain, swelling, stiffness around and alongside the joints. So in osteoarthritis, we have major four stages. There is stage 0, which is normal stage. In this stage, there is no pain. In this stage, all movements are able to be done. If you look on X-ray, there is no findings. You'll find the joint is normal, all the movements are normal. Then here comes the second stage. In this stage 1, after stage 0, in this stage it is minor. It is minor OA, which starts as the year advances. This one, if it happens, there is small and minor injury to the cartilage and small modifications to the cartilage. In this management, you have to change the lifestyle. Lifestyle has to be continued. You have to exercise properly. You have to balance your weight so that too much weight will not affect the joint so that it can create osteoarthritis. You have to stay active. You run, you jog, you do everything that makes your joint and your bones healthy. In the stage 2, then don't forget to take, of course, supplements, calcium supplements to make your bones strong. Then in stage 2, it is mild. This one, there is noticeable damage. When you look in the X-ray shows that there is some changes on the articulating surfaces of the cartilage of the femur and the tibia, which makes the knee joint here. Here, if these changes happen, what we management should be, sometimes there has to be low impact exercises in swimming, hydrotherapy, you know all. When someone is swimming, there will be no weight bearing forces to the ground. It means the joint which is affected, it is not going to go throughout the ground to affect it more. Then apart from that, you have to take, as in this stage 2, there is pain. Pain is there sometimes. Then it means that you should take NSAIDs, non-steroidal anti-inflammatory drugs, like paracetamol. You should take to avoid pain. Another one which you should do is joint protection. You should protect your joint throughout by wearing knee braces and everything. Stage 3, which is moderate, it means that there is frequent joint pain. Joint pain is here too much, which means that it will come alongside with the stiffness and swelling alongside the joint. In its management, NSAIDs you should take paracetamol or ibuprofen to avoid and to reduce pain. You have to take stronger NSAIDs. You have to take corticosteroids through injections to avoid pain. Then after, you should go with the physiotherapy management, which involves the exercise, Q drills, VMO, and all strengthening exercises as you go alongside the disease. Stage 4, which is severe, there is constant pain, which is there always. There is limitation in the range of motion. For example, if someone has moving his joint, maybe knee joint, through extension and he extends full 180 degrees, it means that on extension, he cannot go full 180 degrees. And throughout flexion, he cannot flex his knees on the normal ranges. That's what affected. On the management, Management, first of all, there is surgical management for this case because it is too severe. You should do the TKR, total joint replacement of the knee. You replace all the joints, then they do all necessary changes of the total knee replacement, either cementless or non-cementless, according to the patient's age and the way of practice or exercise. Another one is osteotomy, bone removal. Then the pain control here, you should use opioids, strong opioids to relieve pain and to come back to the normal functions. After TKR, you'll go throughout the physio management and your knee will become stronger as it is. Thank you very much. This was about OA stages.